First to the HIV epidemic in Nigeria. As Nigeria grapples with the COVID pandemic, there's a worrying increase in the rate of HIV infections in the country. A new study has shown that single people constitute 64% of new transmission in the country. And low levels of access to antiretroviral treatment remain an issue for people living with HIV, which leads to several AIDS-related deaths in Nigeria. And perhaps even worse, many people living with the infection in the country are unaware of their status, according to UNAIDS. Well, the UN body that inspires the world to achieve zero new HIV infections. Analysts say Nigeria continues to fall short of providing the recommended number of HIV testing and counseling sites. Well, joining me in the studio to discuss this is the Director General of the National Agency for the Control of AIDS, Dr. Gambo Gumel Aliyu. Thank you so much for joining us on the Arise interview.
Pleasure to be here.
Very troubling statistics when you look at the fact that Nigeria actually accounts for the second highest rates of new infection in sub-Saharan Africa, with about 1.8 million people down with HIV, and many people actually living with it are not even aware. What would you say is the single most challenging issue as far as the war or the fight against HIV/AIDS is concerned in Nigeria?
Well, in Nigeria and globally, the single most pressing issue is knowing your status, knowing about your status. If people will take it upon themselves to know about their HIV status and do something about that status, whether it is negative or positive, then it will take us a shorter time to get the epidemic under control and to make sure we end it. There is no way we end it without identifying people that are spreading it. There is no way we end it without identifying people that are at risk and making sure they have the adequate protection to prevent themselves from getting infected if the risk is taken to get infection.
Is that not in itself an indictment on agencies like yours, NACA? I mean, you have the job of informing Nigerians, providing that public awareness and all of that. I mean, why exactly would you tell us that a preponderance of people don't even know their status?
Yeah, you see, Nigerians, especially over the last 3 years, have done tremendously well. In the last 18 months, 19 months, or 20 months approximately, up to December 2020, Nigeria was able to identify 350,000 people who before they don't know about their status and link them up to care. This is phenomenal because in the past, we identify on the average 50 to 60,000 people every year. But that last 18 months or 19 months, we were able to identify 350,000 people. Why were we able to do that? Because COVID pushed us out of the facility. We were concentrating at the hospitals and around areas where tests are given and services are given. But because of COVID, and even before the COVID to be precise, we have actually programmed out in the community. But the COVID pushed it further. We went to the community and we were able to take these services to the doorstep of Nigerians. And Nigerians responded very well. There has never been a country that has identified 350,000 people and linked them to care that are HIV positive within 18 months.
These Nigerians that you talk about, how much impact are you making in the rural areas where there's a huge percentage, about 4%, even higher than the urban cases of HIV? Are those not being left behind? What's happening on that front?
No, they are not being left behind. Our program reaches out to the rural areas and to the remotest places, in the country. Simply because we have now community volunteers. We have people that are out in the community that go door to door where we know the epidemic is high or where transmission is high based on the data we have, And outside that, we have programs that are targeted at the general population and programs that are targeted at key affected population, the population where transmission is actually high. There are populations that are silent. Transmission usually doesn't take place there. If you see it, you see in isolated cases, and you see 1 out of 500 or 1 out of 1,000. But there are a group of people where you see transmission 1 out of 10.
And with the figures that I'm just reading here, Nigeria actually has more HIV-infected babies in the world. How come, in spite of TCT and other programs to ensure, that mothers don't transmit to their babies?
So
what exactly is wrong? Is it a funding issue or what?
It's not the funding issue. Even the services, I heard you talking about access in the introduction.
Yes, access to
exactly.
ARVs.
Yes, the ARVs are available.
That.
The ARVs are available. They are available everywhere, in the country. But the access has been a problem because for you to access it, you need to know your status. If you don't know you are HIV positive, how will you come and take the medication? And if you know you are HIV positive and you don't know the importance of taking the medication, how do you come to take the medication?
So what strategy does NACA have to ensure that these people who would ordinarily not approach, the hospital, go to the clinics to check out their status, what strategies do you have in place to, ensure that more people actually know their status?
And that is exactly what we are doing now. We are rolling out a PMTCT program, Prevention of Mother-to-Child Transmission program, that is geared towards addressing the community left out. Those people that are not showing up in the facility and they are hauled up within the community, we take the services to them. Just like we take the services to the general population when we are identifying people living with HIV among the general population and the key affected population. That's the same strategy, but our call to Nigerians is that whoever is pregnant today, please make it a duty to make sure that your child is protected from HIV. There is no way we can end it without stopping transmission or eliminating mother-to-child transmission. Otherwise, we are going to go a long way with HIV in our bodies.
Don't you think the problem or the challenge of stigmatization may be behind, or a major factor why people are not, voluntarily turning up to get tested to know their status?
Sure, stigma and
what are you
discrimination.
doing, to get the messaging out that HIV is not a death sentence? What are you doing?
We've said that loud and clear, and we are using you people. You have been very helpful in taking this message to the doorstep of people in their bedroom for them to know, and we now know that Nigerians know HIV no longer kills. HIV no longer show for your face as long as you take this medication. So the most important thing for people to do is to come forward, to get themselves tested, to know about their status. If they have this virus, they take this medication and this virus disappears from their body.
Is there any kind of engagement with other agencies like the National Orientation Agency, for example, to help NACA get its message, to the grassroots?
Yes,
what's the level of engagement?
We have been working together. Not only National Orientation Agency, also agencies like National Primary Healthcare and Development Agency that have structures at the grassroots all over the country. We have been working together with them. We have been together. Remember, HIV response is a multi-sectoral response. It has different line ministries up, including the Ministry of Defense, Ministry of Education, Ministry of Women Affairs, Ministry of Youth and Sport, as well as Ministry of Health. So we all put in hands together, making sure that this message reach wherever it needs to go, and people get the message and use the message correctly.
And I'm surprised when I asked you the question of the singular most challenging aspect of pushing back HIV/AIDS in Nigeria, and you said it's just ignorance, more or less. But I expected you to also say funding is a major challenge, but you say it's not. I know that not too long ago, PEPFAR, for example, cut down its, the number of drugs they sent to Nigeria, whatever other assistance in terms of funding, and other agencies. Are you saying that the gap created by, those have been filled effectively by the Nigerian government?
At the moment, PEPFAR and Global Fund treat 1.5 million people living with HIV/AIDS in Nigeria. The Nigerian government treat 100,000. The money from PEPFAR and Global Fund is already secured and is out there. We're using it and we're making this medication available. The money from the Nigerian government, we are still awaiting release from Ministry of Finance, and as soon as we get that money will be deployed to buy the necessary medications to make available. So
exactly where are these ARVs, the antiretroviral drugs, where are they found? Is it private hospitals, general hospitals, local governments? Where exactly?
So any place, whether it is the private hospital, tertiary hospital, secondary facilities, where HIV services are given, especially treatment, this drug are found there, and they are free.
Okay. Before we round this up, help me address that issue of babies, having HIV, in Nigeria. What exactly do mothers need to do?
Not only mothers, also the husbands, the couple need to know that whenever your wife is pregnant, that pregnancy needs to be tested for HIV. If not for you, for the baby that is yet unborn.
And if the mother tests positive, what then?
That is where the problem is. If the mother tests positive, then that mother needs to be linked to center that is close by, available, where this medication should be accessed, and this medication should be given until this mother delivers and after delivery, to make sure that this baby is saved. If we make the mistake of allowing HIV to slip from our mothers to our babies, we will see no end to HIV infection. We will continue to live with HIV. That must stop.
It really has to stop. I'm hoping that the zero new infections, that is the objective, is realized sooner than later. Thank you so much, Dr. Gambo. Gumel Aliyu, Chairman NACA, that's a national agency for the control of AIDS.
My pleasure.
Thanks for joining us.